Let's talk about the topic of biceps tears, specifically long head of the biceps tendon. Very common, people who lift weights. In some sports, first thing that comes to mind is strongman competitors. When they lift those big Atlas stones, they put their biceps tendon in a very vulnerable position. So if we're going to talk about biceps tears in general, we have to start talking about the natural movement pattern of reaching. Reaching is whenever your arms are in front of your body. And we tend to think of reaching as just with their arms. Or some people, they don't just reach with their arms, they reach with their back, where their spine extends, their rib cage protracts forward, closes in the back. They come nice and upright, and then they reach with their arm. In reality, that's pretty fragmented, but in reality, we reach not just with our arms and our back, we reach with our front, we reach with our sides, we reach with our upper and our lower, we reach with what's inside, we reach with what's outside. So in reality, it's about a relationship of this pattern of reaching. If we're going to talk about reaching, the reaching pattern, we're also going to be talking about, we need to talk about the natural pattern of bending or flexion or folding, as they say, or fetal position bias, okay? And then if we're going to talk about this bending pattern, we need to investigate or entertain the natural pattern in our respiratory cycle of exhalation. And if we're going to talk about exhalation, we got to start thinking about inhalation and just breathing in general. And if we're going to talk about breathing, we're going to be talking about our stress management. We're going to start talking about what is, or what are we afraid of in life that's preventing us from reaching our goals? What's holding us back? We need to start talking about why or what is it that's preventing us from thinking that we are good enough. So you see where I'm getting with this, with these biceps tears? Something to think about.